Hey everybody, this is Dr. Schaefer. I'm going to be talking to you about how to place an IUD and what the role is of the nurse in getting the room ready for this procedure. Like any procedure we do here at HCHC, you're going to, when you room the patient, want to get them one of the procedure consent forms, and you're also going to want to get them our special IUD insertion consent form. So they actually need to do both at this point in time. It's still the provider's responsibility to consent the patient, but you're definitely going to want to get them this paperwork when they check in. You're also going to, of course, confirm what they're there for. In terms of setting up the room, we have some really awesome pre-stocked kits for some of our main GYN procedures. Our IUD insertion and removal kit should have a number of key items already in it. Hopefully it's stocked. The lid should explain what you're going to find inside. And so when I open up my box, hopefully I've got everything I need. This is going to include a sterile speculum, both a medium and a large size for stability. And then also some key tools. So a couple of other things I just want to mention. As most of you are aware, IUDs are a long-acting reversible contraceptive. That's a LARC. And so there's a bunch of different types. Right here I'm holding a Paragard, that's the copper one, it's 10 years. I'm also holding a Liletta, that is a 5-year levonorgestrel IUD. For you to know as the nurse, all IUDs have some very important information. They've got on the box itself a lot number and an expiration date, and we're going to need that information to put in the patient's chart. There's a place for the template for IUDs to record this information. Inside most of these boxes, there is also information for the patient you're going to want to provide to them. That includes when it was placed, when it needs to be replaced, and that's for the patient's medical records. So you can go ahead and get the box opened, but you actually do not want to open the final package containing the device until you're in the middle of the procedure, because if the patient were to change their mind last minute, or there was a problem with some of the initial procedure and the IUD is not able to be placed, if it's that bubble package has been opened, you've wasted a device. So wait till the very last minute to open the bubble pack inside, but you can open the box to get at some of the patient education material. Okay, so what you're gonna do is get the room ready with your box of supplies, the device itself, your consent form. You're going to set the patient up on the bed, undressed from the waist down, usually with a blue chucks underneath. Now, the procedure for placing an IUD, it sounds fairly straightforward. What we're doing ideally is, first of all, placing a speculum. So we get the speculum in, we visualize the cervix, and usually that's step number 1. So far, just like a PAP. Next step is that we're going to want to get, if we don't already have one collected recently, we do want to get a gonorrhea chlamydia swab at the time of insertion. Now, if the patient had one done at their last exam within a last couple of weeks, maybe when they were consented for the IUD, that's fine. But if not, you might need to pull one of these out of the drawer, swab the cervix, and then that's done. Okay. Next thing we're doing is cleaning off the cervix. So you're going to get your provider a couple of big cotton swabs with your betadine. If they've got an iodine allergy, you're going to use Hibiclens, and you're going to provide them with a couple of swabs to clean the cervix. Okay. At that point, your provider is probably going to take off their clean gloves, and you are going to want to hand them a pair of sterile gloves, because at this point they're going to start handling sterile instruments and eventually the IUD itself, which is sterile. So you're going to want to give them that. Cervix is still exposed. We've still got the patient in the stirrups with the speculum in place. Okay. First step is, because this IUD has to go inside the uterus, we need to know how deep the uterus is, and that helps gauge how far we're inserting this. So the first step is to do what's called sounding the uterus. You're going to hand your provider a sterile uterine sound, and the provider is going to take this, and sometimes you'll see them with their sterile gloves bending it or adjusting it. And this is inserted through the cervix, and then it's got little centimeter marks on it. So what we're doing is basically seeing how far in it goes before it runs into the interior uterine wall, and then we can measure when it comes out how deep that is, and we use that to help know where we're placing that cervix. Now, in a perfect world, this goes in really easily. In an imperfect world, in a more typical world, this is a little tight, and so we have to do a couple of things to help this. So you have not thrown away your sterile bag, so the provider tries to sound, is not successful on their first attempt. So they're going to hand you back this device. You put it back in the sterile sleeve, and they may ask for a tenaculum. This is the tenaculum, sterile instrument that's got, once you open it, the ability to kind of pinch and hold onto the cervix. Okay, so that is the cervix, and I'm going to grab it, and once I'm holding onto it, then I'm going to ask for my sound back. And while I stabilize the cervix, hopefully now I can indeed get inside, okay? If I still can't, what do I do? There's a couple of other things you want in the room that again should be in your supply box that your provider might ask you for at this point. Probably the most common would be one of your cervical dilators. Cervical dilator has a 3mm and a 4mm end, and this can help to gently open and stretch the cervical opening. So hopefully between cervical dilator, uterine sound, and the tenaculum, you're going to be able to get into the uterus to sound it effectively. 2 times when you're doing an IUD placement that it's crampy for the patient. Uterine sounding is the first. So with the uterus, once we sound it, we leave the tenaculum on if we used it, but we take the sound out. This is the time when you grab your actual IUD packaging, and you do open finally inside this box the bubble, the plastic bubble holding the sterile device, and you open it sterilely, peeling the label away from you, and you present it to the provider, who is then going to pick it up and do what they need to do to adjust it for the right depth. And then this is the second time it's crampy for the patient. They're going to thread that IUD into place. Now, sometimes sounding worked, but putting the IUD in is tricky. So you have hopefully not just dumped all your instruments into the sink. You want to keep them available, because it's very possible you may have to pass the sound again to your provider so that they can reopen that cervix, and it might take 1 or 2 attempts to get that IUD into place. So, but eventually IUD goes in, the inserter comes out, the instruments come out. The patient's going to feel much better at this point, although they may be cramping a little bit. The last instrument that you're going to need to pass to your provider, if I can find it in here in my box, is a sterile scissor. And this is because the IUD has some little strings up inside that make it easier, hopefully someday, to remove. And the strings get trimmed a little bit, but then that's done. Speculum comes out, all the instruments are done. And then again, the patient will maybe be cramping, so they need to sit up slowly, move slowly, be given a chance to kind of breathe. We often do post-medicate, or at least offer with some ibuprofen at that point. But yeah, usually the patient has done very well, and then they just need their follow-up visit made anywhere from 2 to 6 weeks, depending on provider preference. So stay tuned. In the next short video, I'm going to explain how you're removing your IUD. Thanks a lot.